everyone. We're going to try to go a little bit quicker this time. So we've got myself and Mandy, do you want to introduce yourself?
Yeah, so I'm Mandy Hampshire and I'm Director of Admissions for the University of Nottingham. We also work in collaboration with the University of Lincoln, and anything that I say about Nottingham applies to Lincoln as well, because we have the same selection criteria for the courses and we run our admissions processes together.
And Julianne, would you like to introduce yourself?
Yep. Hi, I'm Julianne. I'm a third-year medical student, and at the end I'll talk about my route into medicine.
Okay. So I realised some time ago that our students arrive at medical school from quite a huge variety of routes. They're not all straight from A levels, and they don't all have 3 A's at A level. So we've designed this session to help you look at the different routes that there are into medicine, and so that you're better able to advise your students. And again, I'd highlight the resources at the Medical Schools Council website as well, about different journeys into medicine. So some of them straight from A levels onto a 5-year course. Some of them will have done a gap year. They might have got their A levels, but they haven't actually been offered any places for medicine, or maybe they didn't expect to get 3 A's at A level, and then they think, actually, I'm going to apply. Some of them may not get their A levels. They might have applied and not got their A levels, despite even maybe being offered a place, and then they may have to resit one or more A level. And more medical schools do accept A-level resits now. Or it might be that they go straight from A-levels onto a 6-year course, or take a gap year and then join a 6-year course. Might be through an internal transfer route as well, and I'll talk a bit about that later. Or it could be that they've done another degree first, and then they join a graduate entry scheme. So that could be one of the accelerated 4-year degree programs that Mandy will speak about later, or onto a 5-year medical degree. And again, that could even be that they've done a degree such as physiotherapy, they've been employed for a number of years, and at a later stage decide they want to study medicine. The Access to Medicine diploma is really designed for mature students who've done some work since leaving school, not for school leavers. So we did actually talk quite a bit about the standard 5-year course in the initial talk. So I'm going to skim over this one, and I'm going to pass you over to Mandy, just to talk about contextual offers and getting into 5-year courses with contextual offers.
Okay, so contextual offers are really about the 5-year course. So 6-year courses already have lower grade expectations, and the graduate entry is something different. So I think, in my mind, contextual offers are about the 5-year course. And I know what's difficult for you advising students and for the students themselves is that we all have different criteria. So every medical school will have different criteria for its contextual offers, and that means it's quite a challenge to find it. You know, you've got to do your homework in terms of students finding out whether they meet the contextual criteria, but also if they don't meet the contextual criteria for one university, then it's definitely worth looking at others, because they may meet the criteria elsewhere. So, and the contextual offer can vary as well. So at Nottingham, our contextual offer is 1 grade lower. So if students are successful at interview and we make them an offer and they put us firm, then our contextual offer will be 2 A's and a B rather than 3 A's. We also have a contextual route through to interview. So students who've attended one of our widening access programs, one of our summer schools, for example, they, as long as they meet the minimum requirements, they will not have to go through the selection process for interview. They are fast tracked through to interview. So contextual, there can be contextual routes to interview, but also contextual offers. So our contextual offers are not just for students who've done one of our recognised summer school programmes. They are actually for anyone who meets the University of Nottingham widening participation criteria, and those are that they attend a state school, and then one of the other criteria, which is either living in an area that's disadvantaged, as deemed by the government, and they can check, students can check that by just putting their home postcode into the postcode checker on our website. And this isn't linked to Nottingham area or the East Midlands, it's a national thing that's been set up by the government. So they must attend a state school and either meet the postcode checker, the sort of deprived area, or have attended one of our recognised summer school access programmes, or have been in care, or have refugee status. So Margaret, do you just want to say a little bit about your contextual offers at Leicester, because they are slightly different, aren't they?
Yeah. So we only give contextual offers at Leicester to those who've completed one of our progression programmes. And so that's the Leicester Enhanced Access Programme, which is done at Leicester, or Realising Opportunities. And Realising Opportunities is something that is more national. So there are many universities that offer Realising Opportunities. And if Realising Opportunities has been done at another medical school, then we will accept that, or another university as well. And then we give a 2-grade reduction for that. When it comes to looking at contextual information for bringing to interview, then what we do is we score the applications and we look in the borderline group at those who have met contextual markers. And they might be things like a UCAT bursary flag, or have attended a GCSE school for the GCSE, so it's got a low attainment rate below the national average. So those criteria are on our website.
Okay, thanks, Margaret. So if we go on to the next slide. So thinking about the 6-year courses, about half of the medical schools offer a 6-year course. And this is an additional year before the 5-year course, and it is aimed at students usually who meet the widening access criteria. So at Nottingham and at Lincoln, it is the same widening access criteria. So having attended a state school, either living in a deprived area or having attended one of our recognised summer school widening participation programmes, or having been in care, or having refugee status. So if they meet the university widening access criteria and they meet the lower entry requirements for the 6-year, the lower than the 5-year course, then they can apply for the foundation year or gateway year. They're the same thing, they just have different names, which is confusing, I know. So they're either called a foundation year or a gateway year. And our entry requirements for our 6-year course are 2 Bs and a C at A level, and we also have lower GCSE requirements. So you can see that that's quite a difference in terms of the A level expectations. So, you know, it's important for students who really want to do medicine, and, you know, that's where they're hoping to be, but they don't meet the standard 5-year course academic criteria. Well, then there are other options available to them, and it is definitely worth them looking at the foundation year courses to see if they meet those criteria. But it is really important for them to check that they meet the criteria, because, as you know, Margaret said, you know, they are slightly different to teach medical school, and Leicester's will be slightly different to ours. And it's really important, because if they don't meet the entry criteria, then they won't be considered, and that is really sad, because that's a wasted place on their UCAS form. We at Nottingham have scholarships, not only for our 6-year course, but for widening participation of students on the 5-year course. We have a lot of scholarships and bursaries available, and at some medical schools there may be particular scholarships for the foundation year students. Margaret, do you want to go on to the next slide about the 6 years? So I know that students are worried that they're going to have to go through UCAS again and have another interview after the first year, after the foundation year, but that's not the case. The students progress through from the 6 year onto the 5-year course. So our foundation year course has been running a long time. The first students graduated in 2018, they're working as doctors, and I can't remember having a student that didn't progress from the 6 year to the 5-year course. So they do move forward. It's like just another year at university. They have to pass their exams at the end of the year, but by and large they all come through, and they are a medical student right from the beginning. that it's not a different, once they get onto the 5-year course, they're exactly the same as the other students, and the degree that they qualify with is exactly the same. It's nothing different. And once they're on the 5-year course at Nottingham, no one would know whether they started on the 6-year course or the 5-year course. Margaret, did you want to add anything about 6-year courses?
No, just to say it's pretty much similar at Leicester. Our 6-year course, straight progression through, and the students do really remarkably well when they get onto the 5-year programme. And likewise, you wouldn't know the difference between them once they've joined the others.
Margaret, how many places have you got on your foundation?
We've got 35 places. We do require 3 Bs at Leicester rather than the 2 Bs in a C, and we have 35 places.
Okay, so at Nottingham we've got 27 places, and at Lincoln we've got 15 places. Okay, thanks. Do you want to go on to the next slide? So for some students, they apply and they have the disappointment of maybe not getting through to interview, not having an interview, or at interview not being successful, or on A-level results say not getting the grades. And I think it's really important to support them. Because medicine is incredibly competitive in terms of the number of applications per place, and not everyone will get through to interview. But if medicine's really where their heart is and what they want to do, then I would be supportive of them. We have plenty of students who have got onto the course, by applying a second time. And sometimes if they actually achieve the grades on A-level results day, then they need to just apply again. And what they should do in the year off is to get a job. Many of them will need to do that to earn some money, but really any job where they're working with the public, will help them to develop their communication skills, their confidence, their team working skills, all of the things that will help to make them a good doctor and will help them at interview. If they haven't got the grades at A-level, then they should consider resitting if medicine's what they're after. And many medical schools now do accept A-level resits. We do at Nottingham, and I think you do at Leicester as well, don't you, Margaret? Yes. So, lots of places do accept A-level resits, not all, but many places do. So if medicine's where their heart's set, then it is worth them resitting their A-levels and hopefully achieving the grades the second time round. Okay, Margaret, over to you. Oh, no, it's me. So the other thing is, if they've not got the grades and maybe they've gone for their 5th choice and done something else, or reapply to do something altogether different, well, graduate entry medicine is definitely an option if medicine's what they're hoping to do. So graduate entry is a 4-year course, and they will complete another degree first. Some of them apply straight after that degree, so they do 3 years of one degree and then move on to the graduate entry course, which is 7 years in total. And I know for an 18-year-old that feels like forever, but actually it's only 1 year longer than the 6-year course. And our graduates will say that by the time they get to the end, it's gone quickly. We do actually have graduates on the 5-year course as well. So some graduate entry courses accept any degree, and some will ask for a biological sciences or life sciences or health sciences degree. At Nottingham, we'll accept any degree, so it could be history, music, maths, anything, and a 2-2. Some medical schools would ask for a 2-1, but at Nottingham we ask for a 2-2. And we don't have any A-level criteria. So for students who don't meet the A-level grades and are not likely to meet the A-level grades, even if they resit, if they do another degree, and then maybe they're mature and their learning style develops and they're doing something they enjoy and they get a good degree and they're still wanting to do medicine, or they decide to do medicine along the way, then graduate entry is definitely an option for them. Okay, thanks, Margaret.
Okay, just to say that they can also join 5-year courses as graduates as well, but there are financial implications to doing that, so they do have to look into that. Another route that some of our students take is what we call the internal transfer route. So Leicester and some other medical schools will accept students who have done year 1 of a programme at the university. So we accept students who have started on biological sciences, one of the medical sciences degrees, psychology, chemistry, or natural sciences, and we offer a transfer scheme so that At the end of year one, if they've got first class marks, that's 70% or higher, they can apply to transfer. We also put minimum A-level requirements on that as well, of 3 Bs, including chemistry or biology at a B. And it is highly competitive. So they apply, we score their application, we invite the top scoring ones to come for interview. They're interviewed in August, just before A-level results come out, and then they're offered their places. So we will give up to 20 places. So that is another route. So they can, for example, if they want to put, say, Leicester as a 5th choice, if they don't get the grades, they don't get their place in medicine, but they get into one of our courses that accept transfer, then they can apply to transfer at the end of year one. However, I would caution that it's not guaranteed. So they have to be prepared that if they don't get onto the transfer route, then they will complete their degree. So it has to be something they enjoy doing, complete their degree, and then they could look at graduate entry medicine, whether that be onto one of the accelerated 4-year programs or onto a 5-year degree. At this point, I think it's the ideal point to bring in Julianne so that she can tell you about her route into medicine.
Yeah, thank you. So I did a degree before starting this degree, so I'm a graduate on a 5-year course. I previously thought I wanted to go into research, so I had done biomedical science at a previous degree university, and then did like a master's in it after. But then after that, I realized I didn't enjoy it as much as I thought I would. So I considered medicine. But in order to fully know that I wanted to do it, I thought it would be great to get some clinical experience. So I worked as a HCA in A&E to find out a bit more about what it's like in a hospital environment. And I thought that was very beneficial for my decision to knowing that I did definitely want to apply for medicine. So I decided to do a 5-year degree because the graduate entry schemes, even though there is a short amount of time, they are super competitive and very intense. And I thought with the extra 1 year, it didn't make much of a difference to me. But like it has been mentioned, it is a financial burden. So some people, not everyone would want to consider being a graduate on a 5-year course. However, a lot of my friends who are on this course, because there's quite a lot of us in the year, I think about 70, 80 of us currently in the like 290 years, so almost a third of us are graduates. A lot of us did work before or continue to work throughout our degree, and were able to get like support from friends and families, or had saved up because they previously worked as nurses, physios, as I mentioned. So I think there was a benefit. I think as an 18-year-old, you think, oh, wow, like coming in so much later, so much older, you think that you're at a disadvantage. But as this whole talk is about, the average age of the first year when I started was around 21. So a lot of people are older. Not everyone is straight from school. And the benefit of being slightly older is that we do have a bit more of the emotional intelligence, a bit more. We've done a degree before, so we are used to being in university and being away from home, making new friends. I think quite a lot of the undergraduates, as we call them, is benefit and enjoy like having us graduates on there, because we encourage them to speak out and be confident and make the most of it. So I definitely don't regret not coming in straight from school. I think it is a good option. I think more people should consider it. But in saying that, I don't think my teachers at school didn't really put it as a very positive sort of route into medicine, but a lot has changed since I was at school. Now that you can do resits, now you can transfer from after doing a degree, like 1-year degree elsewhere. So a lot has changed. So I think now it's a lot more positive, a lot more easier for people to come in at different stages. But I guess as teachers, I think you should encourage students to know that there are different ways, and that coming in as a graduate does have its benefits, even though it also has the main downside is the financial burden, but other than that, we really do enjoy coming in slightly older, getting to grips with everything and just making the most of the degree. So that was what I'd like to say.
Wonderful, thanks Julianne. I would say the other route is through doing an Access to Medicine diploma, but I'd like to emphasise that that is for mature applicants who have left school and worked for a bit before doing the Access to Medicine diploma. It's not that they can do that as an alternative to A-levels. I also made some flowcharts as well, and they're a bit daunting, but if the slides are made available to you, then you can go through these flowcharts and kind of look. So, you know, when you're advising them when they're looking to apply in, what's the likelihood of them getting 3 A's to get in? If not, might they meet the WP criteria, the widening participation criteria, to get into one of the courses, the Medicine with a Foundation or a Gateway course? Or might they meet the criteria for contextual offers elsewhere? And then if they're not likely to get the A-levels and they're you know, really quite unlikely to get them and don't meet the WP criteria, maybe they need to look at, you know, applying for another degree programme, doing another degree and considering graduate entry option as well. So there's lots of routes in for them to go into medicine. It's not that they all go in getting those 3 A's. And as Julianne said, the average age of medical students is not 18. We do have a lot that are far more mature than that. So I would say to you, encourage your students to explore alternative routes if they're not going to get in straight away by that direct, you know, leave school with 3 A-levels and get in straight away. I think we're possibly going to be, the breakout rooms might be finishing. I don't know if Mandy has anything to add.
I'd just say that I don't know about other medical schools, but at Nottingham, the graduate entry route is no more competitive than the 5-year course. If the application number of applicants to the number of places is very, very similar for the graduate entry and the 5-year course. So I can't say about elsewhere, but certainly it isn't more competitive at Nottingham. And we do have graduates on our 5-year course as well. And the students who start on the graduate entry join our 5-year course students for the clinical year. So they're all together, and they bring a whole wealth of experience with them and share that with the students who are younger. And I just think it really broadens the year group and the student experience. So yeah, it's great. It's great having the graduates around.
Absolutely. I mean, as Julianne said, that the graduates do bring a lot to the groups when they're working together and students are working together in groups. They really do bring a lot to it, and the graduates make excellent medical students. So we've just got a few seconds left, and we're going to return to the main room. And once we're in the main room, there will be a panel of admissions tutors. So do be thinking of the questions you want to ask us.